Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Preparing your child for surgery. Part 2. Introduction. This patient education program will help you prepare for your child's surgery. Planned surgery involves 4 steps: surgical consultation, pre-surgical visit, day of surgery, patient discharge. During the surgical consultation, the patient and parents meet with the surgeon to discuss the surgical treatment options and discuss the benefits and risks of surgery. This program is designed for parents of patients who have already been scheduled for surgery. The purpose of the pre-surgical visit is to make a plan for anesthesia. This program does not discuss what happens during the pre-surgical examination. On the day of surgery, if you are not already admitted to the hospital, you will check your child in with admitting before going to the pre-op area. At this time, your child will be asked to change his or her clothes, and you will meet with the hospital staff who will be taking care of your child. After the operation, your child will be monitored in the PACU or recovery room. After surgery, the patient sometimes goes home the same day but may have to stay at the hospital for additional care. When patients go home, they are given discharge instructions on what to do after leaving the hospital. Day of surgery. On the day of surgery, your child will be admitted to the surgical pre-op area and an identity bracelet will be placed around his or her wrist or ankle. Please do not remove it or get it wet. It is best to wear simple, loose-fitting clothes that will easily fit over a bandage. It is also best to leave jewelry and other valuables at home. If your child has an inhaler or nebulizer, please bring it on the day of surgery. Bringing a favorite blanket or toy will also help to make your child feel comfortable. A healthcare provider will review your child's medical history and perform a brief physical exam. Minor illnesses such as colds may postpone surgery. Be sure to tell the nurse or doctor if your child did not follow the eating guidelines before surgery. For your child to have surgery, you need to sign a consent form. Signing the consent form means that you know what the surgery is for, understand what the benefits and risks are, and allow the doctors and other hospital staff to continue with the surgery. During surgery, your child will be given a gown to wear. Next, you will meet the anesthesiologist. He or she will be in charge of your child's anesthesia throughout the surgery. Your anesthesiologist may give your child a sedative to relax him or her before going to surgery. Though your child may still be able to walk, he or she will be taken to surgery on a bed, also called a gurney. This ensures safer transportation. There are different methods to begin the anesthesia. The safety of the child is most important in deciding what method is chosen. IV medications may be used. Infants and young children most commonly go to sleep by breathing special gas through a mask. In cases of general anesthesia, after the child goes to sleep, a tube may be placed in the throat to help continue breathing. In cases of regional or local anesthesia, your child will be given some medication through an IV for relaxation. The anesthesiologist will then inject the actual numbing medication into the appropriate area. It will numb the area and make it so that your child does not feel the surgery. Your child will be closely monitored in the operating room. The anesthesiologist or nurse anesthetist will continually monitor the oxygen level in your child's blood, pulse, blood pressure, and breathing. They will give your child any medications, fluids, or blood that he or she needs. Some of the equipment that is used to monitor your child's vital signs include a blood pressure cuff to monitor blood pressure, a finger clip or sticky pad known as a pulse oximeter to measure blood oxygen level, EKG patches on the chest to monitor the heart, an intravenous line or IV line to give your child the fluids and medicine he or she needs. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Immediately after surgery. After surgery, your child will go to a recovery area or PACU. Some children may need to go to a pediatric intensive care unit or PICU. In most cases, a parent or guardian is allowed to be present when the child is awakening in the recovery room, and you will be instructed when you may join them. To protect the other patient's privacy, we ask that you remain at your child's bedside. The nurse will check your child's condition frequently and answer your questions. Your child may look different after surgery. He or she may appear puffy, flushed, or pale, and may have one or more of the following: IV intravenous tube for fluids and medications, dressing over the surgery site, tubes or drains to remove fluids. The concerns in the recovery room are primarily focused on the heart and lung function, pain treatment, and watching for any problems related to the surgery or anesthesia. Often the child may wake up restless, fussy, and crying. This will usually stop before you leave the hospital. If your child is staying overnight in the hospital, the nurse will be checking on your child frequently during the night. This may interrupt sleep, but is important for your child's recovery. The area where your child had surgery may be tender or painful. Medicine will be available to help relieve pain after surgery. Please let the nurse know if you think your child is in pain. Being comfortable will make it easier for your child to recover. You or your child may be asked to use the number scale or face pictures to identify pain or discomfort. Nausea and vomiting are often common after surgery and anesthesia. IV fluids will be given during and after the procedure to ensure that your child has had enough fluid by the time they are ready to go home. If your child does not want to drink any fluids, do not force him or her to drink. If your child will be going home the same day of surgery, he or she should be able to drink fluids without nausea and vomiting. When your child is awake, he or she will be offered oral fluids to drink. Most children are able to do this within a few hours. Rarely, nausea and vomiting will require a child to remain in the hospital. Discharge instructions. If your child is an outpatient, he or she will be able to go home on the day of surgery. If your child is an inpatient, he or she will be discharged to go home when the doctor says it is okay. You can do a lot to help speed up your child's recovery. Your doctors and nurses will give you specific instructions. These are called discharge instructions. The following are some general suggestions. You will be given instructions about what your child can eat and how your child can slowly progress from drinking to eating solid food. Follow these instructions until your child recovers from the effects of the surgery and anesthesia. In the hospital, if your child feels pain or nausea, tell your nurse. When you go home, do not double up or increase the dosage of your child's medication without asking the doctor. Depending on the type of surgery and anesthesia your child had, your doctor may give you additional instructions. Do not be afraid to ask any questions related to your child's health and recovery. Here is a list of 8 common questions you should ask your child's healthcare providers before you take your child home. What medications should my child take and when? What are the signs of infections and other common complications? What should my child eat? What will happen to my child's stitches and or staples? When will my child see the doctor again? When can my child go back to school or daycare? When and how can my child shower? Can my child play in bed? If you like this video, please like and share. For similar videos, subscribe to our channel. Conclusion. Parents are key members of the healthcare team. Only you can give the special, loving touch that is vital for your child. As the parent, you know what normal is like for your child, what a certain cry means, or when something is just not right. A visit to the hospital may be an anxious time for both you and your child. Your doctor and nurse are available to answer any questions you may have about your child's scheduled surgery. Thank you for using Explain.